If you're currently unvaccinated for COVID-19, get ready to start paying more for hospital care and possibly health insurance. Good evening, and thank you for joining us. I'm Carlo Cicchetto.
And I'm Marcella Lee. Early on in the pandemic, many insurance companies were waiving the costs of hospital care for COVID patients. As Newsday's David Gottfredson reports, most of those waivers have now expired.
Back when the pandemic first began, a lot of health insurers voluntarily waived costs for patients.
Back in November 2020, 88% of health insurance plans were waiving all costs associated with COVID-19 hospital stays. But by October 2021, 82% of health insurance plans will no longer dismiss those expenses.
What that means for patients is that if you have a COVID-related hospital stay, you're going to be on the hook for your deductible or your co-insurance, which could be thousands of dollars.
Cynthia Cox is vice president of KFF, a nonpartisan health policy nonprofit. She says one reason health insurance companies originally waived hospital costs is they wanted to avoid a federal mandate by Congress.
If there had been a federal mandate, they wouldn't have been able to stop waiving those costs when they wanted to.
Now that those COVID cost waivers are expiring, unvaccinated patients are the ones who'll mostly be paying out of pocket. Nationwide, between June and August 2021, 98.6% of people hospitalized with COVID-19 were unvaccinated, resulting in $5.7 billion in preventable hospital costs in those 3 months alone, according to a KFF study. And those expenses may soon be passed along to employees in the form of increased health care premiums. Delta Airlines, for example, recently announced unvaccinated workers will have to pay an extra $200 per month for health insurance.
Some companies are coming out with a mandate that says if you don't get vaccinated, you get fired, you lose your job. The other companies like Delta have had a somewhat softer approach where they say, if you don't get vaccinated, you can still keep your job, but you have to submit to regular testing, and you also have to pay a higher premium each month for your health insurance.
If you have health insurance, a COVID stay in the hospital is going to cost you thousands of dollars out of pocket. On the other hand, if you get vaccinated, you could avoid the hospital altogether. Marcella?
And David, what if you don't have health insurance and you have to pay for those costs out of pocket?
According to that KFF study, the average cost of a COVID hospital stay is $20,000 and much, much higher if you're admitted to the ICU. And again, the cost of a vaccination is free.
Definitely something to consider for those who have yet to get the shot. Thanks so much, David.